Is this just part of aging become an acceptable medical answer? It's Rosemarie, and welcome to Second Opinion. This is the show where we talk about real life and midlife, not health in isolation, but how hormones work, identity, relationships, and the medical and wellness spaces that we move through shape how we feel in our bodies. I'm a healthcare professional and a journalist, and I believe that better questions lead to better decisions and better decades. Today's conversation is for women who know something has shifted and are done being told it's normal, it's just aging, or it's all in their head. My guest is Dr. Betsy Greenleaf. She is a triple board certified physician and a national leader in women's pelvic, hormone, and integrative health, working at the intersection of physiology and quality of life. She brings clinical depth, lived experience, and an empowering perspective to a conversation women are ready and more than willing to have out loud. Dr. Betsy, welcome to Second Opinion.
Thank you so much, Rosemarie. I'm so excited to be talking to you today.
Feeling is mutual. So for anybody who doesn't know you or just learning about you in this space, can you talk about your different boarding, your certification, and how you ended up in women's health?
Yeah, it's funny because people always ask me, especially the gynecology, like, how did you end up going into gynecology? And I don't think anybody, like, as a kid is like, I want to look at vaginas all day long. I don't think that's necessarily anyone's, like, life goal. But when I entered, I knew I was always interested in medicine. And when I started in medical school, I just kind of found myself actually drawn to some of the surgical subspecialties, more so because I didn't like the idea of, like, here's a blood pressure pill, come back in a month. Okay, your blood pressure is still high. Like, here's another blood pressure pill. Like, that drove me crazy. I wanted to actually create some change. So I actually started in general surgery. And then I found that I didn't have that rapport with the patients because I was the one who was walking around after someone had their appendix out and was like, so how do you feel now that your appendix is out? So I wanted, like, more of a relationship, but I wanted the surgery. So then I kind of found myself in OBGYN, which I had fought that because the lifestyle for OBGYN is not that great because, babies come all times of the night. And then I found urogynecology, which a lot of people are like, what in the world is that? And then even when I told my parents, my mom, when I was going into urogynecology, she was like, what is that, like fancy gynecology, like European? Like, it wasn't like the understanding that it's like like urology having to do with, like, the bladder and the pelvic floor and gynecology combined. So it's a combination field. And in fact, there's only about 1,500 urogynecologists in the country. And it's a pretty new specialty and new meaning, like, in the lifespan of medicine, it's new since, like, the 1970s. And I was actually lucky enough to become the first female that was board certified in that profession. Interesting enough, we were talking about how I'm triple board certified. So I also have a board certification in aesthetics. And that actually happened because I was using Botox since the early 2000s, not for people's faces, but for the bladder and for pelvic floor, because there's usages for that. And patients would always say, like, if there's any extra, can you stick it in my face? So I was like, well, let me figure out how to do that. So I ended up getting training in all of that area. And I'm actually currently working on a 4th board certification with Dr. Andrew Weil in integrative medicine.
Very familiar
it's just
with
more
him.
of like, I love education. I'm always looking for more answers.
I always say, too, like, being a healthcare background, and you like to coach yourself as well. I became a journalist as a frustration for what I saw in healthcare. I think you can't go wrong with knowledge, seeing the connection between urology and women's health. Maybe we'll expand on that. Even some of your patients, how they come to you or how they find you.
Yeah. So, a lot of times when I was doing straight urogyn, because I'm actually retired now from pelvic reconstructive surgery, but that was more of a referral type of industry. And that, like, the regular gynecologists, they don't do everything. I think there's this misunderstanding that gynecologists should know how to do everything. And so the frustration I'm seeing now with patients is in the menopause space is you see people complain all the time online. Like, I went to my gynecologist and they like didn't know how to do my hormones. Well, they're not necessarily trained in hormones. And so they're just because they do women's health doesn't mean they do all aspects of women's health. I mean, that's what we did with Urogyne. Like, I do like a lot of recurrent urinary tract infections, recurrent pelvic infections. And so if you think of like the gynecologist, like a general gynecologist, more as like this general practitioner, just like your family practitioner. They know a little bit of everything, but not like everything about one thing. So, they can usually get you to where you need to go, but a lot of times they don't know everything. And when it comes to the hormone conversation, unfortunately, menopause has been very overlooked in the past by the medical profession from an educational standpoint. In fact, there were some statistics not too long ago. I know this is changing, but like 23% of graduating OBGYN residents feel like they're even prepared to talk about menopause in their patients. And I know with myself, we got like one lecture on menopause all through OBGYN residency. And the argument has been in the past, well, we just can't include everything in the curriculum. But my frustration, and I think what patients are experiencing, you spend more time in your life in that perimenopause, menopause, and postmenopause phase of your life. Why would the education not be geared towards that level of health versus like most of the education for ANs is towards the obstetrics, not even the office gynecology. It's more geared towards the obstetric area. And I think that also comes from that's a little bit of politics, why that is happening. And the politics are that hospitals get paid money from Medicare to have residents. So it's not like the hospitals are like, oh, we want to be altruistic and teach all these people. There are probably people that work at the hospital that have that attitude, but the hospital as a business goes, hey, for every resident that we physically have in the hospital, we're getting paid money from Medicare. So do we want them doing work in our hospital basically for free because the residents aren't getting paid that much? Or do we want to spend time educating them? Well, unfortunately, from a business standpoint, we're going to spend time getting free work out of them, which the demand is on the labor and delivery floor, not like educating them on menopause and hormones, because those aren't the people that are coming necessarily into the hospital. So I think in general, we actually have to we talk a lot about looking at the healthcare system, not really as healthcare, but it's more disease care. But also we need to look at the medical education system, which is really not a lot of education. There's just a lot of free work and on-the-job education. And when you're not exposing your residents to a major topic in women's lives, and that's why women are suffering now, because their doctors are just not educated. And unless they're purposely seeking out that education after graduation, they're just not going to know it.
You touched upon a really good point, and we can have a whole podcast on that. If you live in an area, say New York, Boston, these areas where we've got pristine medical care areas in Texas, Chicago, and there's gaps in these systems, what else is happening in the rest of the country? But I feel like that education part is huge. I'm going to go into some numbers because you nicely set me up for my question without realizing it. Well, you have only a specific amount of, say, physicians that feel ready to go treat these patients. And a little bit of data that I found before we talk about like symptom solutions, zooming out, because the scale I think matters. You have a percentage of physicians that don't feel good. And physicians go into, medicine, most I know, to help people. And then that doesn't feel good if you don't feel adequately trained. You have patients in front of you. I can't imagine the frustration, how you feel. And then you have this patient sitting across from you as well. So you have approximately, I looked at the global numbers, at 1 to 1.2 billion women worldwide are currently in perimenopause, menopause, or postmenopause. And then approximately 47 million new women enter menopause each year. So, and then you have increasing life expectancy. And then you have 1 in 4 women experiencing some severe symptoms. When we look at these numbers, how does looking at the data change how we should be looking at healthcare? Rather, is what we are doing now, and it's globally, I saw this. That explains why my podcast is being seen in 20 countries. I couldn't figure out why. And I'm like, wow, women really are looking for this information.
Yeah. I mean, obviously there is a great need, and it's a great need that's not being addressed. And so I think that because of those numbers, unfortunately, healthcare in general tends to be very slow to adopt. It doesn't move as quickly as businesses do. And I think that's another reason why you're seeing right now that menopause is now like a hot topic, is because the business industry as a whole has realized this is a giant segment of people that can be sold to.
Exactly.
Now, with that, so I'm very excited that menopause is like the topic now and that we're focusing it and it's being talked about, which I'm like, yay. But there's also this other side to it in that industry is now catching on that. Number one, that's a group of women who are older, who have more access typically to money. So they're more likely to be spenders. And so now we're starting to see a lot of products coming out that are marketed specifically to midlife and beyond and menopause. And so I'm also telling people to kind of watch out, because just because something has a menopause label on it and is being sold, we now still have to start questioning, is it something that's really good for us in midlife, or is it something that like, okay, there's a large population of us that now, a large segment of the market that are being sold to. However, medicine hasn't caught up with that yet. So the medical industry always lags behind. They're always like slower to innovation. They're always slow. And tell you the truth, I also have 2 business degrees on top of all this. So so I'm watching this and I'm going, all the other, like the entrepreneurs and other businesses are seeing this as a giant opportunity where medicine hasn't really caught up. Like they're starting to be like, okay, like I guess we need to really start educating people and we got to start working this into the curriculum. And so, so there's kind of this a little bit disconnect still between the market and what's happening in medicine. But the market we need to be watching, because I see companies that have had products for years and all of a sudden they go, oh wait, let's smack the word menopause onto name and repackage these things. And now we can sell this stuff as a menopause, whatever. I don't want to throw any companies under the bus.
No, I feel you, because no, Dr. Betsy, listen, because you don't know what's driving it. Because even in our feeds, right, our social media, our news feeds, you love those algorithms. You look on one thing and then all of a sudden, everything you're getting marketing to, it's like, oh, this woman's in menopause. She's into hormones. And then you don't know what to believe of what's, it's so unregulated. I feel like in some other areas of medicine too, that we're seeing in New York, it's like when there's no regulation, it's like the gold rush of medicine. It's like, right? Like you said, oh, this is not right. We've got parts of it are regulated, parts of it aren't. Women are, I hate to say it, but they get desperate. Working women of a certain age, we're living in our prime right now. We're at the top of our careers. Many of us are juggling family, career. We're not like our grandmothers or a mother. I mean, it's just very different world that we're living in. We live in a visual world. We need to look our best, not for other people. We want to look and perform our best as well. Yeah. So I'm really glad that you touched upon that. And so with that, I think it's interesting, like, even though as also a consumer of medicine working in healthcare, right? But we all go to our own doctors and the level of frustration that sometimes we feel. Do you think with that, like with these increasing numbers now with this industry, like you said, menopause is like a buzzword right now, the whole pipeline, like what does this mean for primary care? Also OBGYNs, primary care, cardiologists, like you said, I feel like there's so much pressure put on your OBGYN. And then also, but I feel women, because I feel I'm included, I was guilty of this. I love my OBGYN. I'm like, well, you're more like my primary, because they're not getting answers from their primary care. They're not getting answers from their cardiologist unless you're lucky to have sifted out, somebody for, who understands women's heart health. So Do you think any of this is almost going to force, or I don't know? I mean, does that question make sense?
Yeah, no, exactly. And I think the other factor from the kind of lack of education in the past, because this has just kind of been a topic that's been overlooked, but then we also are dealing with the Women's Health Initiative study that came out in about 2000 and put the fear in doctors. Because, you're right, doctors ultimately went into this because they want to help people and they want to improve people's lives. And all of a sudden, back in early 2000s, it was like the Oprah meme. We were giving hormones to everybody. It was like hormones for you, hormones for you, hormones for you. And then all of a sudden, the New York Times printed the article about the Women's Health Initiative, which was a study that was done on hormones, which now we know was a terrible study. But it's kind of like if somebody came out tomorrow and said tomatoes are bad for you. Everybody would stop eating tomatoes. They'd freak out. And I'm not saying that that's true, but it's just an example. If that went out viral, it would be a big deal. Well, we didn't have the viral things, thank God, back then, but the New York Times did a lot of damage with publishing that article in the way it was published because everyone got scared of hormones. And so one minute doctors were prescribing them, the next minute they were like, no, first do no harm. So there were a lot of hot flashing, pissed off menopausal women around that time and continued on for many years, even up to today, because doctors were like, oh my God, hormones cause heart disease, hormones cause breast cancer. Oh my God, I don't want to hurt my patients. So we're going to freak out and we're going to take you off the hormones. And even we see this with our big organizations like the American College of Obstetrics and Gynecology. They did not have, I'm going to just call them out, they did not have the balls to say, I think it's from New Jersey, they didn't have the balls to come out with an official statement on hormones. And even then they're still kind of a little wary because now it became, well, all right, do we have the evidence-based medicine to support this? And we don't necessarily have the evidence-based medicine in some ways. And so they couldn't even say or give doctors any guidelines on what to do with hormones because they were afraid to do something. Because what happens if someone got hurt or got, cancer or got heart disease or whatever? So everyone just kind of became like a deer in headlights and became paralyzed around the hormone conversation. I mean, I know myself, I had a hysterectomy at 41 and I didn't go on hormones because I was like, I don't want to get cancer. I don't want to get heart disease because that's all I was ever trained. And it wasn't until I started experiencing my own menopausal symptoms that I was like, kind of dove into I need to figure out what is going on for real here with the hormone situation. And even then, so the study with the Women's Health Initiative, the study, what gets really focused on was the estrogen progesterone arm, where there was a slight increase in heart disease and clotting and breast cancer. However, the problem with that study was multifolds in that it was done on an older population that maybe based on their age, they had issues. But the bigger problem, it was the type of the hormones that were used in that study. And more so the progestin that was used, which was a not natural progestin. I don't always like to use the word bioidentical because sometimes I feel like that word has been overused and has some kind of, people, sometimes it evokes opinions and emotions around that word. But the hormones that were used in that study were not natural hormones that occur in the human body. And so we now know that those non-natural hormones are processed in a completely different way than our natural hormones and have a tendency to go down a toxic pathway that can, I'm not saying it will. And that's the other thing is when this study came out, it was you are going to get cancer. You are going to get heart disease. No, even if you took those hormones, which I don't advise, but if you did, you could process them down a metabolic pathway that could make toxic metabolites, that could damage the DNA, that could potentially create a situation that would make you more prone to cancer. And we know that those hormones are very inflammatory, which could lead to heart disease and strokes. So there was a lot of things, but it really paralyzed doctors and patients for decades. I mean, we're still just starting to come out of it. And so I think the nice thing about the menopause kind of revolution that is happening now is we're seeing the consumers pushing the medical industry so that, the FDA just this past spring had a panel where they looked at, do we really need to have these black box warnings on like vaginal estrogen? As practitioners, we're like, vaginal estrogen is not likely to cause some of those health conditions that like heart disease and breast cancer that we were putting it with. So the FDA is like, all right, what is really going on? And they're starting to make, changes by taking that black box warning off. And we're starting to see a big push in our big organizations to be like, all right, we need to address this on a deeper level. So at least that's starting to change. But I think it's more of a grassroots type of thing I think also too, you got a lot of Gen Xers like hitting menopause. We're the kind of the population that we're not going to take it.
I'm glad you brought that up because that was even a big question that I had. All of a sudden, the end of 2025, are we opening this 20-something-year-old data? I feel like a lot of women are saying that too. Like, why all of a sudden?
I think it's a combination of things. I think it's the group of people that are hitting menopause right now, which are going to be your Gen Xers, which typically as a whole and as a generalization are not people that tend to keep their mouths shut and go along with, just go with the flow. They're like, they stand up for themselves because they've always had to figure things out, like being the latch kid keys. They were the ones like figuring everything out for themselves. And so they weren't happy with the answers they were getting. So I think part of it is that. I think part of it is actually pure business theory. If we look at pure business theory, it's a bell curve. With any technology, there's always going to be early adopters. Then it's going to become more popular. Then there's always a gap between at the time of the early adopters starting something and when things get adopted by the main group of people. And so there have always been early adopters using bioidentical hormones. We've been around. None of this is new to us. We've been using it on our patients. We've been doing it, And now all of a sudden that gap period is kind of gone. And now the people that are in that like main group of people that are like, well, we need more proof. We need more support. We're a little bit scared. Like now we're starting to see doctors go, okay, you know what? Now I have the permission to start using this stuff. So now we see a bigger group of practitioners that are willing to now go and start using these modalities. And so I do think that the Women's Health Initiative kind of harmed hormones for a long time, but I think now it's a couple things coming all together at once. And I think moving forward, we're going to see a big change in how hormones are looked at and how menopause and even aging is looked at.
I'm with you on that because I was trying to educate myself on all of this as well. For myself, even as somebody, as a consumer who hormones have worked for me, why did this take so long? And the real cost to women. We have all these estrogen receptors in our body, how they affect our vascular health, our sleep, our mental health, our bone density. So the disservice of overall health, I'm glad that you brought that up. Do you think there's anything that's still not changing or are we moving in the right direction?
The one thing that drives me crazy is I think it's criminal. My opinion is that it's criminal that the non-natural hormones are on the market. And now we actually have to go, well, why? That's also a question. Why are bioidentical hormones not supported or just starting to get supported versus there's tons and tons and tons of research on these non-natural hormones? Why are they even on the market? So the reason they're on the market, once again, I didn't realize I was going to incorporate so much business into this interview, but the reason why they're on the market is actually not a health decision. It's a purely business decision because you can't patent something that naturally occurs. Bioidentical hormones are not patentable. So if you can't patent something, there's no business protection. There's no intellectual property that you could patent and then sell. So what happened in the hormones have been isolated since the 90s. They were actually used as early as the 1950s and 60s commercially. But why they were, what happened was companies went, well, we can't really make money off of natural hormones because we can't patent them. We can't protect our products. But if we take a natural hormone and we put some other molecules on it and we tweak it and we make it this new novel molecule, this new compound, we can patent it, name it something, and sell it. So that was a pure business decision that these hormones, these non-natural hormones even exist. It had nothing to do with medicine. It was to protect their intellectual property. And now here's the other thing is, where's the research money? The research money is in the things that we can sell and make money off of. There's no research money in bioidenticals. So, and that's the argument, because I teach a lot of doctors and nurse practitioners the hormones. And so sometimes I get the more conservative practitioner who's like, but I'm scared to use these things. I'm scared to prescribe them because I don't have research backing me up. And I'm like, here's the problem. You're not going to have the research to back you up because there's no money in research, because it costs a lot of money to do research. That's why the pharmaceutical companies, and I'm not like vilifying the pharmaceutical companies, they're doing what businesses do. They create something that they know they can make money off of. They put lots of money into research because they're going to make it back on the other end. So there's no funds for bioidentical because there's no money on the other end because it's natural and you can't patent it. So that's one of the bigger problems. And so I think that's where we're lacking. I think we do need a lot more research on bioidenticals, but it's going to be using creativity to come up how are we going to get the funding to do that research?
No, it's interesting because I love reading comments online. I feel like I go to things just for the comments, as many people say. And women are savvy. It's the first thing that they're thinking of. Well, why now? Where's the money being made? And you can't help us as a society to feel that way or be a conspiracy because look what happened over the last, few years. The pandemic, I don't even want to go down that road. That caused a lot of skepticism. Women do know that they're the largest consumers. They do know that they're the ones spending money, and midlife women. And of course, their mind goes to, I don't want to be taken advantage of. Where am I getting ripped off? Why all of a sudden people are skeptic because they still feel like someone's benefiting by lifting this. So you don't know what to believe and what to think. Hopefully we move in the right direction. If we don't, we won't ever get the data if we don't start, like you said, many physicians are already prescribing hormones depending on your doctor. But yeah, how are we supposed to get the data? It's so frustrating looking at menopause today compared to, say, our mothers and our grandmothers. We look different today. I'm not making light of it, but we've come a long way. I even think about when my mom was my age. But I think when you're 20-something, everybody 40-something or 50-something seems old. But it's really a different world that we're living in, how it's different.
Yeah, definitely. And forgetting Botox and fillers for a moment. But if you were just to look at like what a woman looked like in her 30s and 40s, like 50 years ago, they looked a lot older than we do now,
Yeah.
So it's not even just all the things that we can do aesthetically to our faces. But, I think there's a different level of aging, which is interesting. This is something I question because actually the food back then was more pure. And so we should have had less inflammation and less risk of chronic diseases, which we did. But why did we look older? I'm not exactly sure. Maybe we're spending more time in the sun than we do now. But
that's a good point. Because stress was always around. Stress has been around, right? Here, to be human is to be stressed. It's all relative at the time. But what was it? Like you said, the food, nothing was processed. Everything was homemade. I don't know. That's a really great thought. Why is that?
And there was less pollution. So I don't know why we would have looked older back then compared to now. But maybe there's just a lot more Botox in the world. I don't know.
But we also didn't have, I think wellness wasn't, that's a really great question. We didn't have the contaminants, I think, that we do now.
Yeah. So we should be looking older now than we
probably with stress. That's funny.
I think because women in general just accepted it. Like everything was accepted as a normal part of aging and nothing was really questioned. And so, if like in the urogynecology world, I see this all the time. People would come in with incontinence, leaking, which is very common, but people don't talk about it because they're leaking urine. They just go, okay, this is what it's like to get older. And they just go buy, adult diapers when there's so many things that can be done for that. So I think in the past, women were just kind of, hot flashes were kind of a joke. And I kind of feel guilty now because I remember making fun of my mom because, there were days that we would find her with her head in the freezer. And it was really funny. And, it was just kind of like, all right, this is what it's like to get older. And it just got accepted. And nobody was like, wait a minute, do I have to be like this? Like, I don't want to be like this. What can I do to change? And so I think that's people are starting, not only are they talking about it amongst their friends, but they're starting to question like, why is this? Why do I have to be like this? And even questioning the grander scheme, like people used to think of menopause, okay, stopping the period and hot flashes. Those were only things people thought were the symptoms. And now, because of people asking the right questions, we're able to look more at the science and realize that these hormones are neurotransmitters. They're not just affecting our sex organs. They're not just causing like dry vagina and hot flashes, and they're affecting the way our brain is functioning. They can affect our speech patterns, whether we're tripping on words or forgetting, where we left our keys, and, brain fog and energy levels. And like you said, these hormones affect every cell in our body, and they're really able to connect that all, those aches and pains that people were like, oh, that's just naturally getting older. Like, no, that might be menopause. And there's things that can be done, and you don't have to stay like that. But you know what? That's actually that's a good point too that I want to bring up. Is I see this we see this in everything in society right now, the extremes, the people that are for and against every topic you could probably put up here. Like there's a group that's going to be super for it, and there's going to be a group that's super against it. And so I'm seeing this even when it comes to hormones. I see people on social media going like, everybody needs to be on hormones. Like, there's no excuse, start your hormones. And then there's the group that's like, we weren't meant to take hormones. We didn't evolve to take hormones, like just age naturally. What I think is great is that you have a choice. Like, you could do either side, and either side is right. Like, I don't think it has to be black and white. Like, there's so many choices. And I think that's the big thing is understanding now in our world is that you don't have to accept the way you are. And if you're uncomfortable with something, there's choices. There's choices to change that. There's choices to feel better. And if you're perfectly happy with just going through the natural aging process, that is a great choice. That is a choice. And, so I don't think there's a right or wrong when it comes to this. Opinion of me, the only opinion that I think is wrong is those stupid, I'll call it those stupid non-natural hormones, which I think are criminal and should get off the market.
Really glad that you said that because you are a physician. There's this gray area. And I, as someone who's gone through this myself in my own journey, but I think that it's, like you said, either way is a disservice because it sways people. Because when you have a title, people, a lot of people will listen to what you have to say and hold that to be true. I read something and it really bothered me. And I work in healthcare. I work with doctors every single day. So we all think differently. But there was a doctor had she was a contributor in an article, was talking about how like basically hormones were bad and we should set women the natural aging process. And, we need to change the standards of beauty. I don't really agree with that message. Of course, we wish that we view beauty standards differently. But as a working woman of a certain age in New York City or a major city or anywhere, frankly, it doesn't matter. You want to look and feel your best. I thought, well, who are you to say? Like, so you're not going to prescribe hormones? Like, that's a disservice to your patients. I personally thought that. I didn't really like that narrative, but
I also like to point out, because this is another thing I'm seeing, is people thinking that hormones are the answer.
yes.
And so sometimes I'll do that as a social media post to shock people and be like, hormones don't work and hormones aren't the answer. Because here's the thing, they're not the answer. They're not this panacea. They're just a tool in our toolbox. And this is why I see all the time people come into the office and they're like, well, I want what my friend had. My friend's libido is through the roof, and my friend that feels this. I want exactly what she had. Well, guess what? Your body might not respond to that in exactly the way your friend had. So that's, I think, and that's an area of medicine that we really need to look at is individualizing this. Oh gosh, no, now I'm going to open a can of worms. All right. Another thing I'm super frustrated with is now that hormones kind of have this permission and doctors are now prescribing them. I'm seeing a group of doctors that are looking at it from a money-making standpoint. And they're like, I'm going to go into the hormone field and I'm just going to prescribe these hormones and we're going to just keep giving hormones and we're just going to keep upping people's levels. And if they don't feel it, we're just going to keep upping their levels. Well, there's a couple things with that. Number one, why I say hormones don't work and they're a tool in our toolbox is that hormones don't necessarily stay as hormones unless you're in a nice, relaxed state. Because there's a process in our body and the pathway that the hormones come down in our process, and actually naturally, if we were not to supplement with hormones, cholesterol, which is often vilified, is actually a hormone. In a nice, relaxed state, it will come down and be made into your sex hormones like estrogen, testosterone, progesterone. But in a stressed state, the body goes, we don't need our fertility to survive at that moment. Like if a lion is jumping out of the bush, we don't need to be having sex. We don't need fertility at that moment. We need to survive. So all of our sex hormones get converted, or all the resources for those sex hormones get converted into cortisol, which is our stress hormone. So I always say like sex and stress can't coexist. So this is where hormones aren't the answer for every symptom, because if you have a level of stress in your body that you can't utilize those hormones, all the hormones in the world are not going to overcome that stress. So we really need to start looking at what are our stresses, and that can be mental stress, that could be physical stress. So that could be our health, it could be our diet, it could be not getting enough sleep, not drinking enough water. Exercise, even though it's great, too much exercise is a stressor, and that's actually, I see my exercisers who get hormone replacement and they don't feel it. And I'm like, well, guess what? You might be exercising too much and you're converting it into cortisol. And I'm not saying like stop exercising because we need to do movement, but this is where the hormones are just a tool and we need to make sure the body is optimized to be able to use the tool. And then the other thing with this is treating levels. Like my normal level, it might be different than your normal level. And the laboratories, when they report a normal, and it depending on the lab we look at, like serum has the widest, like blood levels have the widest range. They're only reporting what's the average of the labs that they're processing. So like if you were to isolate it really, if there was a lab in like New York that only processed people from New York and there was a lab in like Hawaii, like those lab ranges may be actually different. So, and your bodies don't follow a textbook. So one of the first women I ever prescribed hormones to, it was amazing. I kept trying to adjust her hormones to be in range. And the more I kept trying to adjust it, and this was when I was new in the field, so I didn't really know exactly what I was doing. But every time I tried to adjust it to get her labs to look right, she felt terrible. So then I was like, wait a minute, let's start tracking your labs over time and track your symptoms. And I found out for her, she felt great when her labs looked low because it wasn't, so it was low according to the laboratory, but it wasn't her low. And so that I think is really important because especially in the pellet field, this is a big frustration of mine. I'm seeing doctors throwing these hormone pellets in people and putting way too much hormones in them because they got taught at a course like, hey, put this much in or, get them to this level. And it just might not be right for that person. So it's really more of an art than it is a science. And, I think we need to go back. Many of us, especially myself, when we trained, we were told, treat the patient, not the lab. As the labs just give you guidance or help confirm what you think. You're already thinking, but if you actually look at the person, they'll tell you what you need to know. And you just need to adjust based on that. So I think that there's really a big art to prescribing these medicines. And so that's another kind of fear of mine. Well, actually, another pet peeve of mine are these online companies that are popping up where you don't even see a practitioner. You're like, it could be midnight and you're like, I think I want to start hormones. And you find these websites and you go put your information in, you put limited amount of information. They're not doing labs. And next thing you know, you got your hormone prescription in the mail. The thing I am seeing is I'm getting a lot more people that are complaining like, oh, I tried that company and it didn't work. But then I think in some ways we might start seeing a backlash as hormones become really popular. I think we might actually get a backlash against hormones because it's not the hormones, that the hormones not done optimally.
I'm glad you brought up with this online situation because you're seeing all these pop up, and I don't want to get in trouble, so I don't want to say any names, but
yeah, that's why I always be careful.
Right, but there's a lot of these clinics online, and they push out very great information online, on blogs, on social media. However, what, advice to women who are struggling, listen, I live, in an area where I don't have the best access. I've been to this doctor. I just feel like there's many women that are tuning into all this information because they don't have access. Like, what are they to do? Because it's easy, like you said, out of desperation for some, it's like they've been down all they've trial and error and they're not making any movements. What do these women do?
Yeah. So, I mean, the advantage of these companies is access, and they tend to be a lot cheaper. So I think in that way, it's really good. But I think that if you're getting the hormones and you are from them and you're just not feeling well with them, here's the thing, really listen to your gut feeling and your intuition because there is truth in that. So if you're just feeling like this is just not right, then maybe look at where you can work it into the budget to try to find a better option, or educate yourself, like listening to amazing podcasts like this. There's so much education out there. There's some things you can do yourself. I will tell you the interesting thing officially right at the moment that this is being recorded, and it has been for years, there is no recommendations from our bigger organizations to even test hormones before putting people on hormones. So what these companies are doing is not wrong in the world of what's been put out there by medicine. It's not the way I do it, but and I will tell you, it really interesting. I just did one of my board recertifications, and there was a question on the test. And the question was like, a woman comes in her 40s and she wants to start hormones because her friend got hormones and her friend felt better. What is your next step? And the answers were, give her hormones was number 1. Number 2 was check her blood. Number 3 was like check saliva, or the other or check urine. Like it was all. Now for me, I'd be running some sort of testing.
Of course.
The correct answer, according to the OBGYN boards, was put her on hormones.
Wow. Not even assessing the situation. You got to clean out your closet or figure out what's in it.
The recommendations. And the reason why that is because the answers, well, we don't have great research on the testing. But like I said, I think in some ways evidence-based medicine has hindered medicine in some ways. I mean, I think we need we don't need to go back to the snake oil days. I mean, back before the FDA existed, there were a lot of medicines that contained mercury, and people were getting sick. So we do need to test and question things, but there's also this area of medicine that's just the art of medicine, and we might just not have evidence-based medicine or giant randomized controlled studies on everything. So some of it is really just going to be up to the art of that practitioner.
Wow.
And then the other thing with that is I see patients all the time who are complain about their doctors, and I'm like, we need to maybe look at this from almost like a dating situation. You shouldn't be dating somebody that you don't like. And then that's a whole nother topic, the people who stick around with people that don't treat them well. But if you don't like somebody and they're not treating you well, go find somebody else. There's somebody else out there for you. I'm going to be an awesome practitioner for some people. Some people just might not like me. That's fine. My opinion, my personality, they might just not like. Great. We don't mesh. So you not only have to like your doctor, because the other thing is if you have rapport with your doctor, you're more likely to follow what they do and more likely to trust them. If something's off, you don't feel good, you don't like the way they're treating, that honestly, if the doctor's insulted that you like went someplace else, then that's even more of a sign that you should leave them, because like just go find your person. Like there's going to be somebody out there for you. So
No, I'm glad you said that. It is like dating. And we've all, you're like, well, we're just not really a match. We're not on the same page, or you're being gaslit a little bit. And
it's not you, it's me.
Yeah.
Don't start pulling out all the whatever lines you got to.
Yeah.
I need to break up.
Exactly. And you're there trying to figure out, well, what did I do wrong? I did all the right things. I eat good. I go to the gym. I meditate. I mean, what more can I possibly do? I have no guilty pleasures. Literally, it's just coffee. Like, what else am I giving up in my life? Like you were saying, not everybody is for everyone. There's different ways of approaching it. Well, and this brings up a question too. And I thought to ask you, because certain women have been on birth control more, say, than our mothers and our grandmothers, right? Women who are getting married later, having children later. How's that affecting fertility? There's a lot of things that I feel like women now are dealing with that our parents and grandparents didn't deal with. Do you have any thoughts on that as well?
Yeah, how many hours you want to spend?
I love this, because I thought, listen, I geek out on I listen to science podcasts when I'm not even I'm just one of those people too. But it's like, because it affects us, our friends,
I would love for somebody to steal this idea, because I don't have the money to do this. But somebody please start a bioidentical birth control company, because here's the biggest problem with birth control. The hormones that are used in birth control are not bioidentical, bioequivalent. They're not natural occurring hormones. They are incredibly inflammatory, and they affect gut health. So they affect absorption of nutrients. So long term, they actually can increase our risk of inflammatory conditions, chronic disease, autoimmune conditions, and affect fertility, because like gut health is very closely related to fertility. They're terrible. However, I say that the risks of pregnancy and dying in childbirth are a lot higher than the risks of non-natural hormones of birth control. So we got to look at, what there are. The advantages of the birth control pill in particular is that it can decrease our risk of ovarian cancer, because we're not ovulating every month. And every time you ovulate, you actually damage your ovaries. So there's a higher risk in people who ovulate more with ovarian cancer than somebody who doesn't ovulate as much. So the birth control helps decrease risk of ovarian cancer. It decreases the risk of pregnancy, within itself has a lot of risk. So there are advantages to the birth control. They're just, in a perfect world, they're terrible hormones. So like if somebody could just create a bioidentical birth control, I would be so much happier. I mean, given the choice, if you can go with an IUD, that's a much better choice, because of the fact it's not going to affect you systemically as opposed to the hormones that are used in birth control. So, and then this is the problem that we see, unfortunately, our 40-something-year-olds. So like perimenopause. And here's the other thing that I see on social media. People are like, oh, I went through early menopause. Menopause can naturally begin as early as 38. So it can naturally begin that early. So if you're in your 30s, early 40s, that's still natural menopause. The average age of menopause is 50, but that doesn't mean that that's your average. But it's that perimenopausal period when the ovaries are kind of starting to go into retirement. I don't like they say that they're like shutting down, or medically it's called ovarian failure. I'm like, no, they're not. Like they're going into retirement and they're slowing down. We get these really like vast like ranges of hormones that cause the period to kind of be a little wonky. Like sometimes you get it for like 2 weeks straight, and then you won't get it for like months on end, and then you'll get it for 3 months straight. And then so that time period is really difficult when it comes to regulating the menses, but also that's when all the surprise pregnancies start coming up. Somebody who's already had their family, and then all of a sudden, oops, guess what? You're having another one, because people don't know when they're going to get their period, and are they in menopause, or oops, wait, we're pregnant. That period of time is when women really need birth control if they want to control that. Some women misinterpret, well, I'll just go on birth control and that'll be my hormone replacement. No, it's just not the same. And in fact, actually, what we use in hormone replacement, the levels of hormone are so much lower than what is used in birth control, which is funny because people have been so scared of hormone replacement, but not as afraid of the birth control. And the funny thing about it is, even if we looked at the quote bad hormones, like hormone replacement bad hormones are still much lower levels of hormones than what are being used in birth control.
So, that's really interesting.
Yeah.
I bet you a lot of people don't know that.
Yeah.
And
no,
like you said,
I also don't want to just talk everyone to go off their birth control. We're going to have all these like Dr. Betsy babies out there.
Exactly. But no, I'm glad you brought this up because I have a wide network of friends, different ages. And that was a conversation actually. So it's interesting that you brought that up. So is there really a right answer?
Very individualized answer for that, but just knowing the risks and benefits on both sides.
Yeah. And then say with fertility, again, we could have separate podcasts on all of this, but so many women who had gone through fertility who are now on hormone replacement therapy. Could that be something down the line that doctors start looking into?
I definitely see that could be a really good area for research because you have to think like what exposures are affecting people's, risk factors down the line. And so I don't think that we have, we should, but I don't think that we have that kind of data at this point in time. But if you think about the first quote test tube baby was in I think it was the 80s. I remember as a child, like that being big in the news, like we should have data on all this by now.
Yeah.
So. Yeah.
And how about women who don't have children? Do you have any thoughts on that?
Yeah, no, from a medical standpoint, not necessarily. The thought, and even then the rumor is like, oh, you're going to go through it like the way your mom did. But even then, there's not direct correlations. So there's no way to predict at all. Unfortunately, women who've never had children, who've never been on birth control do have a higher potential risk of ovarian cancer. And so this actually comes from they did studies on like nuns versus I think it was like a group of Amish people because the Amish were not using birth control, but they were constantly pregnant. So their ovaries weren't ovulating all the time. So every time you ovulate, the egg is breaking out and it causes like a little scar tissue. They thought that it was that repetitive damage to the ovaries that could potentially trigger an increased risk of ovarian cancer. So they found that ovarian cancer risks were much higher in like nuns than it was like people who were pregnant all the time, which you could also then transfer over into some sort of like chemical birth control, like a hormonal birth control. So,
oh, wow. That's interesting. That answered a lot of questions. Thank you. I have so many questions. I will be here all day. I'm going to jump to where women still feel dismissed because of data. The data doesn't seem to be backing up. They're not feeling good, but their lab results are being read another way. I can tell you, I don't mind sharing a little bit of personal information because I feel like maybe somebody could relate to this. Like I was in my late and I was having some issues like sleeping or night sweats. They were working me up for diabetes. They're like, maybe you're diabetic. I was living in LA, running, cycling. I was really healthy. Now it does run in my dad's side of the family, but I didn't have the profile, my diet, my exercise, even my panels, my blood work. And then they were worried that my sugar was too low, that it was spiking high. But I thought now looking back, not one person thought, maybe she's not one thought that maybe it was more of a hormonal situation.
Yeah. Well, estrogen affects our insulin sensitivity. So when we start to go into perimenopause and menopause, we actually increase our risk of developing diabetes because it affects the way we process insulin and glucose. So there is definitely a correlation. And so even like estrogen, and estrogen is not the only hormone. We have estrogen, testosterone, progesterone, but even all the menopausal hormones will affect I was going to go down a road and I just blanked out on what I was going to say.
Insulin?
But it's like, like thyroid. Like a lot of times they'll look at thyroid, but estrogen can affect thyroid. So sometimes you don't have to fix the the thyroid, sometimes by treating the estrogen, we can improve those numbers. So same thing. Sometimes we don't necessarily need to go down the road of the diabetes or the sugar. Maybe we need to treat the estrogen, and then that can help. Even when it comes to cardiovascular disease, like as we get older, we're more at risk without the hormones of having arrhythmias. So that's like palpitations, your heart racing. So, actually that's hard. Finding a cardiologist that specializes and understands women's health and the effect of hormones on the heart is really hard to find somebody that does that. There was a doctor in my area for a while that I sent everybody to. She did it, and I don't know where she went to. But yeah, because these hormones, we start seeing more of these problems as we are entering menopause. So instead of women getting put on medications for blood pressure, because it'll affect blood pressure, it affects your cholesterol when these hormones start to drop, it affects our risk of heart disease, it affects our risk of arrhythmias. So it might not be being on all these other heart medicines. I mean, there's definitely a role for them. I'm not saying like don't ever take a medicine, but we need to get down to the root. I'm really about root cause. Like, what is really the underlying thing that's driving this? And then, well, actually, if you want to go even deeper, this is why, like, I don't tend to just give people hormones. I do a lot of microbiome work. And so microbiome is basically, there are bacteria and organisms that live on and in our body. And the microbiome is different in each area, but the gut microbiome has a large effect on our wellness. It's actually, if our gut is off, it'll affect our libido. So let's say you got somebody coming in for libido, and I'm giving them like maybe testosterone to try to boost their libido, because that's what a lot of hormone doctors will do. Like, let's just give you testosterone. And if you're not using it right, then we got to go figure out where the stressor is. And the stressor could be that your gut is off. And that because there have been, thank God now, we do have the research showing that if the gut bacteria is off, not only does this affect libido in both men and women, but it can affect fertility, because the body is very smart. It senses something's not right. And your body doesn't know the difference between like you want to make a baby versus you want to have a fun night with your partner. Like, to your body, like sex and fertility are all the same thing. So your body goes, oh, there's inflammation here. There's a stressor on the body. Something's not right. Let's shut down fertility because this is not the time to be reproducing. So yeah, so actually this is why like the standard American diet is really horrible, not only for your sex drive and fertility, but just for your overall health. I mean, it affects your risk of chronic disease. Yeah, and from a personal standpoint, I'll tell you, this is how I figured this one out. Is I had a hysterectomy when I was 41 for ovarian cysts, and I was like, oh, let's just take everything out. Went through instant menopause, and I didn't put two and two together because I was like, I'm not going on hormones. They cause cancer. And I started having some mood issues. They called it depression, but I was just angry and pissed off all the time. I was just really, really mean. I was like everybody just annoyed me. And then I was getting sick all the time. So I went to a doctor and ended up having to go to an immunologist, and had this whole immunology, like my immune system was being worked up. And they're like, you have this genetic condition called primary immune deficiency that shows up in your feces, and there's nothing you can do about it. You're just prone to getting sick. And then all of a sudden, like, this was when I was starting to get into the integrative and functional medicine, and I started looking into like, wait a minute, a little light bulb went over my head. Like, what does my mood and my immune system have to do with each other? Because it seemed like it was happening all at the same time. And this light bulb went off, and I went, oh, my gut. Because 90% of your happy hormone is made in your gut. 80% of your immune system is made in your gut. And now connecting this also with hormones, in menopause, we do get shifts in our gut microbiome. So a lot of times, women are being placed on antidepressants for anxiety and depression at this time, and it's being blamed on their hormones or blamed on like, oh, this is just natural part of aging, and they're getting put on antidepressants that may or may not be working, when not only do we have to look at the gut health specifically, but how, because sometimes going on the hormones doesn't fix it. So we need to look at it all together. And in fact, actually, the hormones can affect the gut, because too high of estrogen can make you constipated. And the interesting thing about constipation is that we excrete some of our estrogen through our stool. So if we're constipated and our stool is sitting in our colon, we're actually going to reabsorb some of that estrogen back into our system. And now that's going to raise our estrogen even higher, which is going to slow down our gut motility, our gut movement, our bowel movements even more. So it becomes a vicious cycle. So even sometimes, connecting that if somebody's having, let's say they're having problems with their hormones and can't regulate it, sometimes the answer is just pooping better. So, or sometimes it's like eating more whole foods, getting more fermented foods into your diet, like getting away from the standard American, fast food and sugary drinks. And yeah. So
I'm glad you brought that up. Two things, because my doctor, she focuses on gut health as well. I'm so grateful I have her and people like you. It's definitely a case-by-case situation. It's not one remedy is going to fix everything, but it's all part of it. And I'm glad you touched upon antidepressants, SSRIs, because I know women who are frustrated. I'm not downing doctors, by the way, because we only have limited information. I'm not doing that at all. You said listening to your gut. So I'm glad you brought that up.
And it definitely, all the antidepressants affect sex drive too. So,
yes, exactly. Yeah. And it's like this meno divorce, right? We've got this late in life. It's like all these things compounding, but you said it beautifully earlier. You don't want to blame it all on hormones. It's like a case by case. Okay. All right. Again, we could go on and on. It's becoming more common knowledge how people associate estrogen just to your sex, your reproductive system. They're not realizing in your heart and different parts of your body why you're feeling all these different things.
Yeah, it's actually something interesting, and it just kind of reminded me that's interesting that we're seeing them do with like Olympic athletes when it comes to estrogen receptors. So they figured out in menstruating women that, first of all, estrogen is very high at the beginning of the month, and then progesterone, and then comes down, and then progesterone's high at the end of the month. They have found that you have more resilience to exercise at the beginning of the month than you do at the end of the month when you're under progesterone dominance. And so there's more likely you're going to get injured in a menstruating woman who exercises harder at the end of the month. So they're starting to do this with Olympic athletes, which is called cycle syncing, and it's affecting your training based on your cycle. And now taking that forward into menopause, if our estrogen is low, this may be another reason why we're more prone to like sports injuries and ligament injuries. Is it because the estrogen is low? And so, it's interesting. We don't have. I've seen all the sports industry, the sports exercise studies when it comes to menstruating women. I don't see them yet on women who are menopausal, but it's kind of interesting because they do know this. And also we know that like in cycling women, that because of the neurotransmitter effect of these hormones, there are better times of the month to be making decisions. Mid-month, when the estrogen at its highest, we tend to be more aggressive. And so that's actually a better time to ask for a raise. This because of our brain chemistry. So they're like, that's like a better time to make more like decisions. So now I guess, extrapolating that to menopause, but I don't have the studies to prove this. Like, are we going to have harder time making decisions because that estrogen is low? So yeah, it's interesting.
I feel a little frustrated when for women, hormone replacement therapy is how much money we're spending out of pocket, whereas, and then there's all these risks involved. Many women who are frustrated, or when it comes to men's health versus women's health, everything's always presented as risks instead of benefits. Where men, I'm like, did anybody put all these risks about, Viagra, or was this ever a concern for erectile dysfunction? Again, I'm not trying to make this political, but you can't help but wonder, why is it we never heard of all these potential side effects for men as opposed for women? I don't know.
You know what the interesting, here's another thing. So this also goes back to research. Where's all the research being done? It's being done on men. That is not 100% a sexist thing. What it is scientists trying to take out as many factors as they can from a study. Because honestly, you can't really do research on a body in a vacuum. There's so many factors. But one of the factors with women is women can get pregnant. So
yes,
there was just scientists doing science things is like, let's take out as many factors as possible. And, do we want a woman getting pregnant in the middle of a study, and how is that going to affect our research results? So they were like, well, easy way, we just take women out of the studies so we don't have to deal with that factor. So that was a pure science decision. However, it has a lot of impacts because most of the research on most of the medicines that are on the market have been done on men. So do we really know how these things work in women? We don't know, because women aren't just like men with vulvas and boobs.
Like older women aren't just estrogen deprived younger women.
Yeah, exactly.
Right? So it's more complicated than that. Although we feel like it sometimes, I can say, full disclosure, because I do feel good on hormones. But again, it's not for everybody. And okay, so what if there's somebody listening, she's not feeling right, she keeps getting brushed off, and what would be the next practical step for her?
Yeah, the best thing now is the internet. Even though I usually tell people don't Google things, but this is actually probably a good, or even ChatGPT or whatever's the newest thing that's going to be out there. But, just start searching, because you really have to be your own advocate, especially, you have to be your own advocate every day. You have to even be your own advocate when you're at the doctor's office, because if they're recommending something and you're like, I think gone are the days where okay, I did it because the doctor told me. I think people are really questioning it. So you really need to spend some time and do some research and try to figure out who can do this kind of work that you work with. I think it's kind of rare that people meet somebody in high school and fall in love and live happily ever after. A lot of times, many of us have to kiss a lot of frogs before we.
Yes.
So you may have to try out a couple people, and don't be. I know the tendency is to get frustrated. I get it. Everybody wants things yesterday, but really